You're listening to the Geriatric Mamas Podcast with Jessica Raziri
and Sonia Tapley.
Yeah.
So this week's episode is all about reversing menopause. I didn't know it was a thing. I was like researching something about embryos, yada yada, and then I stumbled upon this episode by a fertility center in Greece. And
you stumbled upon this episode or article?
I mean, article. Sorry. Thank you.
I'm like, what episode?
In last week's episode, I said when I was talking about ultrasounds, I called ultrasound C-section. So I'm really glad that you just corrected me.
At least you didn't say like, oh, we have 5 subscribers, so that means we only need 95,000 left. I have like so many people correct me on that. I'm like, I'm aware. Thank you.
Yeah. Yep. That's hilarious.
We did revise the number in the show notes, guys. I hope you're looking at those. Sonia spends a lot of time on those. She does a really good job.
I need to talk about those show notes more in social media so that people know that they exist.
My math was not mathing on that, so I do apologize. I'm not a.
But we're not mathers. We're not mathers.
I'm not a mather. I've never been a mather.
Right.
So
exactly.
Sorry. I know you're trying to get through this intro.
No, it's fine. We digress. For this episode, we're going to be talking about an article that I stumbled upon by a fertility clinic in Greece that currently does stem cell procedures to temporarily rejuvenate menopausal ovaries, causing egg cells to grow and the aging effects of follicles to reverse. So that's pretty amazing. They also use the stem cell procedure on uterine linings to rejuvenate endometrial growth, since pregnancy rate is increased with growing endometrial thickness, which we know because we had to take like estrogen when we were trying to do IVF to thicken the wall. So, for women looking for a more natural approach, the clinic offers other ideas to reverse menopause that have been helpful for women who are still in their 40s. There's a lot of reading and research for this episode, so bear with us, but hopefully it's somewhat helpful for anyone who's trying to conceive with a low AMH or a thin uterine lining. So,
we're going to do our best. We are not doctors. We are not mathers. We are not scientific at all. So we are probably going to be stumbling over words and saying things incorrectly. But just know that all of the correct information will be properly displayed in the show notes. So if you're not understanding something, I probably wouldn't just be listening to this episode and taking notes from this. I would probably literally just go straight to the show notes, because chances are we're probably going to say some things that aren't 100% accurate, but we're going to do our best, because it's really fascinating. Like when I was in the thick of my fertility journey, like I was looking up all of this stuff and just so fascinated about all the things. One thing that was really frustrating, though, and we're going to get into that, is that like a lot of this stuff, it's offered in Europe. It's, it's not available in the US. And it's just so frustrating, because it's like, I just know I would have been all over it, even though it's like so expensive. Exactly. It's pretty. So the first article that we have is, sorry, I don't know. I'm like staring at the words and I'm like, how do you read? Sorry.
And all she's had is orange juice, folks.
Literally. Okay. Yes. I'm on cough medicine and orange juice. So, in this article, 12 things to know about emerging therapies for menopause reversal. Greek fertility physicians invented the procedure known as ovarian rejuvenation for menopause reversal. Platelet-rich plasma, which we're going to call PRP, is injected into your ovaries during the surgery. PRP is concentrated solution made from your own blood and is employed in different areas of medicine. The process is based on the PRP's inherent growth factors, which can help with regeneration of tissue, increase blood flow, and decrease inflammation. The theory is that it may also reverse signs of aging in your ovaries and activate previously dormant eggs. Is that the same of what they do with the vampire facial?
Oh, I haven't heard of vampire facial. I mean, I have heard of vampire facial, but I haven't researched what it is. So
I think it's the same. I think it's similar. We need to look.
Oh, I bet it is.
I think it's the same because it's like they like make you. They use your own blood.
Mm-hmm. Yeah.
And then it's to help regenerate like new skin cells, basically.
Oh yeah, that's what it is. So is that stem cells?
I think it's the same. That's
the vampire facial is like stem cells. Sounds like maybe. We'll look it up.
Again, we're not
put it in the show
scientists.
notes.
We're not scientists.
Yeah, no, we're not. We're going to put it in the show notes, so don't you worry.
Okay. Doctors tested this in a small research with 8 women in their 40s. Each of these women had gone around 5 months without a period. To assess how well their ovaries were working, researchers measured their hormones levels at the start of the study and every month after that. All of the participants resumed their regular periods after 1 to 3 months. The mature eggs were then accessible to the doctors for fertilization. Getting pregnant after beginning menopause is doable. That's underlined. So it's to make, when you really need to drive that point home. Although difficult, being pregnant during premenopause is not impossible. Did you ever watch Real Housewives of Dallas?
No, I didn't. No, there was a show that was about Dallas before that, but no, I didn't.
Yeah, well, so I think it was Brandy. She was the redhead on there, and her and her husband were trying to have a baby, and it just wasn't working. And apparently, she found out that she was in premenopause. Yeah, and so like she was struggling, and so then they adopted a baby, and then she got pregnant naturally.
Oh my gosh, seriously?
Yes, so she got pregnant while she was like premenopausal. So it's like it can happen. It's right. Not common and it's not easy to do, but it can happen. But I just thought of that.
Yeah, that's so cool.
It's crazy. Your ovaries might start releasing eggs again after surgery, like ovarian rejuvenation. Your ovaries mature follicles rupture during ovulation to release an egg or eggs. Ovulation becomes less regular after premenopause sets in, and you don't release a viable egg every month. The fact that your ovaries still contain healthy eggs is what matters. All you need is one, ladies. The ovarian rejuvenation technique might aid in restoring or rebalancing the hormones that regulate follicle maturation and bursting. This will enable you to conceive naturally or will enable medical professionals to retrieve an egg for IVF. Researchers discovered that all 4 participants produced an egg that could be harvested for fertilization in one peer-reviewed study that had been done up to that point. Man,
that was
a lot. I feel like my mouth hurts. My like cheeks hurt. It's like
I'm so sorry.
However, much. I was so much reading.
So to summarize, I guess what they're saying is that this is entirely possible. We can jumpstart the ovaries using basically stem cells. So we are going to get into
so crazy,
right? So we're going to get into exactly what ovarian rejuvenation means,
because there's like vaginal rejuvenation.
Oh yeah, they talk about it. This place does that too, so they talk about that.
So I wonder if they do like a package deal that's like give me the
ovaries, uterus, and vagina.
It's like give me the Virgin Mary. Like it's like what's the special called? Like it's like
I think that's a question
it's like literally
that we
like
need to ask.
Yeah.
That's a really good question.
Interesting. Yeah, I didn't know there was a surgery for. Did you know there was a surgery for ovarian rejuvenation?
No.
I didn't know that.
No. Just learned it from these articles. So, exactly what is ovarian rejuvenation? Ovarian...
What is ovarian rejuvenation, you ask? Well, we will tell you.
Yeah, and let me just try to stumble all over all of these words and see how I do. So...
Oh, God. I have a lot of editing to do for this episode.
It's fine. How ovarian rejuvenation works. Stem cells can, under the proper biological stimulus, morph into any type of cell in the human body, including eggs. The presence of stem cells in the ovaries and their transformation into mature egg cells has been demonstrated in mice by Harvard researchers. Stem cells have also been shown to be present in the human ovary. So it is quite possible that they can be transformed into eggs by growth factors contained in the individual's own white blood cells and platelets, which have been injected into the ovary. Injections of growth factors, when used for many other types of medical treatments, are made from a patient's own blood and blood cells. The latest results at the Kret clinic in Greece. According to our latest data, the success rates of PRP reach over 85%. And according to our data so far, the pregnancy rates that we have achieved after PRP are 48%. Of which 26% was achieved with natural conception. Can you imagine, like, conceiving naturally after going into
That's
premenopause?
crazy.
Right? And then 48, both PRP techniques, transvaginal ultrasound and laparoscopy, I don't know, it'll be in the show notes, can be carried out in their clinic. The success rates of both techniques coincide. So, for their experience in the field of fertility, it's been evident by the study that they've done, and it has already been published with data from 2017 to 2018, and it is the most extensive study in the world as far as the number of patients are concerned. In a short while, their new study, with a sample of about 500 patients, will be published, which will prove their new data, which is even more encouraging and exceptional. I mean, 85% seems like a pretty good success rate to me.
Yeah. Considering, like, IVF success rates are usually, like, what, like, in the 40s? So,
yeah. Right.
Yeah. That's crazy.
Right?
That is so crazy. But this isn't offered in the U.S., is it? Is it just offered
I don't think so. The only thing that I could find after I found this was from them, so.
That's so annoying.
Right, so ladies.
It's because the U.S. is like, oh, it's like you're playing
ethical.
God. Yeah, it's not ethical. You're playing God, and, like, it's not God's will to do this and that. And it's like,
yeah, there's a lot on ethics out there. Like, when you Google like fertility stuff, there's a lot on ethics out there, and, like, some of it I don't even really fully understand.
Well, the thing is, too, it's like, yeah, we're applying this to fertility, and we're talking about reversing menopause and, you know, ovarian health and stuff like that. But, like, stem cells, I mean, that's a whole other huge thing.
Right.
But, like, you could literally reverse, you could make somebody who's literally, like, a vegetable.
Right.
Totally reversed. Like, you could give them a whole life. You could, like, reverse, what is it? What does Selma Blair have? Is it Sal's wait, how do you say it?
Oh my God, Bell's palsy?
Bell's palsy.
No?
There, I'm like, Sal's policy? I don't even know. Yes. I think that's what she has. But you can reverse that. Like, it's so crazy that the U.S. is, like, not jumping on it.
I'm just curious. This is now popping into my brain for some reason. Like, why did we want to be the first on the moon, but we don't want to be the first to jumpstart our ovaries?
I don't know. It's, like, also the same question of, it's like, we're so concerned with what's in the outer space, but it's like, we don't even know all the species that are living in our own ocean. Like,
yeah,
it's like, why don't we, like, see what's going on here? And why don't we like further expand? But yeah, I don't know. I mean, there's all these different types of scientists discovering different things, but it's just a matter of where the government wants to put the money in the research. So, gotta love it. So we have another article, Enriched PRP. So PRP is an innovative regenerative therapy, which, okay, first of all, disclaimer, there's a lot of really big words in this one. So, we're just going to push through, and you're going to get what you get. And Jess, I'm going to right now tell you to just, if you want to skip over this whole part and just refer directly to the show notes, go for it. Okay, so PRP is an innovative regenerative therapy which involves the application of autologs, platelet, leukocyte-rich plasma containing growth factors and thrombin directly to the site of treatment. PRP treatment has been used broadly. This is such a hilarious topic. In several areas of medicine and aesthetics to relieve pain, reduce inflammation, initiate healing, and course regeneration and rejuvenation of the tissues.